Dr. Dentico YouTube channel, and this is a continuation video of impaction. In last video we have covered definition of impaction, physical barriers of impaction, theories of impaction, okay, and we have covered indications and contraindications we have covered, right? So in this video we will going to cover classification for this impaction, right? If you don't have seen previous video, I will give link in the description box, okay? So here we will today start with the classification, and in classification we have a main three classification, which first is the winter classification, then Pellin-Gagry. In Pellin-Gagry we have two criteria. One is on basis of Ramus relationship and another one is basis of occlusal relationship, okay? Third one is the relationship with mandibular third molar. This is specific for mandibular third molar. This both are also specific for mandibular third molar, okay? So mandibular third molar in relation to inferior alveolar canal. Sorry. In this we have two criteria related to tooth and related to inferior alveolar canal. In this video we are going to cover this two classification, okay? I will make separate video on this, okay? So first we will start with the Winters classification. In Winters classification, it is based on angulation, okay? It is based on angulation of long axis of Mandi third molar into Mandi second molar, okay? It means we have to make a long axis related. Suppose this is your 7 Mandi second molar and this is your Mandi third molar. Then long axis for this is long axis of second molar, right? And this is long axis of third molar, right? So we have to mark this. What are the angulation between this long axis and this long axis, okay? So on the basis of this we have a 5 type, but I think so 6 type, because sixth is lingually rotated teeth, okay? Sixth one is the lingually rotated, okay? We have this 6 types, okay? First is our mesioangular, second is our distoangular, third is our vertical, fourth horizontal, fifth inverted, and sixth is the lingually rotated, okay? Mesioangular, distoangular, vertical, horizontal, inverted, and lingually rotated. Among this, mesioangular is the most common and easy to remove, okay? Mesioangular is most common and easy to remove, okay? And distoangular is least common and difficult to remove. Most commonly seen is mesioangular and least commonly seen is distoangular, okay? So mesioangular is easy to remove and distoangular is difficult to remove. How? We will see, okay? First we will start with mesioangular, okay? Now in mesioangular, as you can see here, this tooth is our first molar, this is our second molar, and this is our third molar, right? So you can say this is long axis of second molar, okay? And this is long axis of third molar. So you can see that it is mesially towards the second molar, right? It is mesially towards the second molar. That's why it is called as mesioangular. This is called as mesioangular, okay? Then this is distoangular, okay? You can see that this is long axis of second molar, this is long axis of third molar, okay? So it is distally rotated. So this is distoangular. Then we have this vertical, okay? You can see this both long axes are parallel to each other, right? So that's why it is a vertical, okay? Then this is horizontal, because you can see almost long axes are perpendicular to each other, right? So this is our horizontal. Okay, then we have a inverted. This is our inverted. पूरे के पूरा tooth उल्टा हो चुका है, right? So this is long axis of this. This is long axis of this, but still it is a inverted. Okay, then we have a lingually rotated. Lingually rotated. In lingually rotated, what happened, that this is lingual surface of third molar, you can see. Other than this, what we can see, tooth is complete tooth we can see. Either it is distoangular, either it is mesioangular, either it is vertical, or either it is horizontal, right? But in this we can see lingual surface of tooth, okay, which is not common at all. Okay, it is very difficult to remove, so it is a lingually rotated. Now we have seen mesioangular, which is very common and very easy to remove. Okay, why? Because you can just insert it your elevator and all those things, you can easily, this is an operable site. Okay, easy to convince. Okay, but this is distoangular, so you have to operation site is also less, and still you have chances of fracture occurring here, right? That's why this is the difficult one, right? Now second classification, which is Palin-Gregory. Okay, now in Palin-Gregory, as we know, we have two. First is our Ramus relationship. Okay, first is our Ramus relationship. How Ramus relationship? We will see here how much space is available to eruption. Okay, so it is based on space availability. Based on space availability. In this we have a three class. First class is class 1. This is class 1. Okay, this is class 1. In class 1, what we can see, space between distal surface of mandibular second molar. This is distal surface of mandibular. I think I should change color. Yes, this is the distal surface of mandibular second molar, right? And this is anterior border of ramus, right? So in between this we have a sufficient space. Okay, how much sufficient space? How we will count this sufficient space is that we will first measure mesiodistal dimension of third molar. Okay, mesiodistal dimension of third molar. Whatever mesiodistal dimension is there, if that much space is available for in between this anterior border of ramus and mandibular second molar distal surface, if this is enough to erupt this, then it is a class 1. Suppose mesiodistal dimension of this is our B. Okay, sorry, yes, it is B. Okay, this is our mesiodistal dimension and this space is A. Now if A is greater than B or A is almost equal to B, then this is a class 1. Okay, now we will move towards the second class, which is class 2. In class 2, insufficient space is there, you can see this. Okay, this is anterior border, this is a space available, and this much is mesiodistal dimension. So in this, A is less than B. Okay, so this is almost no space is available, right? No, I can't say no space, but not enough space is available here. That's why it is class 2. Okay, then we have a class 3. In class 3, no space is available at all. So you see, almost no space is there. Okay, that's why it is a class 3, and this tooth is completely in ramus, right? It is completely in ramus. Tooth is completely in ramus. That's why it is very, very, very difficult. Okay, this tooth is very difficult to remove. Why? Because it is completely in ramus, almost complete in ramus. You can see here, right? So this is our class 3. Now in Pelengagri second, which is occlusal relationship, we have seen here ramus relationship, right? Now we will see occlusal relationship. In occlusal relationship, this is our first molar, second molar, and I have drawn third molar in 3 scenarios. Okay, this is third, and this is also a third. Now how we will differentiate here? Classes, it is A, B and C, right? Suppose I will give name here A, B and C. Now we will see how it is classified. Okay, so first I will draw a occlusal line. So you can see this is a occlusal line. Okay, this is our occlusal line. Okay, and other than this I will draw a cervical line. This is our cervical line. Okay, this is our cervical line. Now what are the scenarios for A, B and C? We will see this. So in A, what we can see in A, that impacted third molar is either at or above the occlusal. I'm sorry, I have drawn by mistake. 1 second. This tooth should be like this. Okay, this tooth should be like this. Okay, now in A, with what we can see, that this third molar is either at or above the occlusal line. It means it is in functional position, so it is at or above occlusal line. Okay, now we will see the scenario of B. What are the scenario for B? We can see that below occlusal line, right, but above the cervical line. It is below occlusal line but still above the cervical line. So it is our B, below occlusal and above cervical line. Okay, this is our B scenario. Then we have a C. In C, it is beyond or below the cervical line. Okay, it is below cervical line, and it for that we can see it is very deeply seated, right? Deep seated molar, and also it will be most difficult. Why? Because we have to cut this much bone also, and there are chances that it is near to inferior alveolar canal also, right? So that's why it is very difficult. So C condition is difficult to remove. Okay, then after this, third one is based on type of impaction. This is very easy. Why? Because based on type of impaction, we have just 3 types. One is soft tissue impaction, partial bony impaction and total bony impaction. So what is about this? Suppose I am talking about soft tissue. So what will happen in soft tissue? That suppose this is our mandible. Okay, this is our mandible. No, I don't think. Yes, this is our mucosal line. Okay, then this is tooth. Okay, impacted tooth. Now it is just beyond the soft tissue. Okay, that's why it is a soft tissue impaction. Now partial bone impaction. Suppose this is our mucosa, and after this we have our bone, and tooth is somewhere between this. Okay, so it is like this. So it is a partial bony impaction, right? It is a partial bony impaction. Now if we talk about complete bony impaction, this is our yes, this is our complete bone. Okay, this is our bone and tooth is inside this, so it is a complete bony impaction. Okay, one is soft tissue just beyond the mucosa. Second one is partial bony, half in bone, half in mucosa. and total bony, totally in bone. Okay. And third classification is relationship of mandibular third molar in relation to inferior alveolar canal. Okay, this is important one, so I will make separate video on this. So this was about today's video, and in today's video we have covered different kind of classification. In classification we have start with first, which is Winter's classification. In Winter's classification we have seen angulation, based on angulation, in which we have seen mesioangular, then we have seen distoangular, then we have seen vertical, then horizontal. After that we have seen inverted, and then we have seen lingually rotated. Yes, one thing, whenever you will see this lingually rotated graph in radiograph, it is called as bull's eye appearance. What is called as bull's eye appearance. Okay, so this was one point. Then Pellen-Gregory classification we have covered, based on Remus relationship, based on space availability. In this we have seen three conditions. In first we have enough space, second not enough space, third no space. Okay, in occlusal relationship we have seen with the based on occlusal line and cervical line. In this we have three scenarios. First is at or above occlusal line, second is below occlusal and above cervical line, third is below cervical line. Okay, C1 is the most difficult one. Then we have C based on type of impaction, soft tissue, partial bony, total bony. The inside some soft tissue, inside partially in bone and partially in mucosa, and total in bone. Okay, so this was about today's video. I hope you have liked this video, and thank you so much to listening me. And if you have still any doubt or this, you can comment me or you can DM me on Instagram. My Instagram page is Dr. Dentico by Dr. Devyani. Okay, thank you so much. So in next class we will cover relationship of mandibular third molar in relation to inferior alveolar canal. Till that, read well, study well, best of luck for your exams, and don't forget to subscribe, like, share, and please make it more subscribable and more likable. If you have any doubt or any topic you want from me, you can please comment me, or either you can DM me on Instagram. Okay, thank you so much.